8:40 right now, 55 KRC, the talk station. Brian Thomas here. Happy to welcome to the 55 KRC Morning Show from TriHealth, Jamal Boyd. Jamal, good to have you in here. You are the Director of Diversity, Inclusion, and Language Services at TriHealth. It's good to have you in today, sir.
Thanks for having me on the show this morning.
So you're from Philadelphia originally?
Yes, sir. Moved here in 2013 from Philadelphia to take on a role with one of our health systems in the region, and just recently in the last year joined TriHealth as their Director of Diversity, Inclusion, and Language Services, and also have responsibility for supplier diversity there as well.
Okay, well, TriHealth, of course, a very well-respected health institution in this area and touches a whole lot of lives, those good people at TriHealth. And but you're going to have to explain to me, and the reason you're here for our Ask the Expert, Director of Diversity, Inclusion, and Language Services. It sounds like something that you'd probably more find maybe at a college, for example, than in the healthcare system. So what's the point of all this, Jamal?
Well, diversity is very important to any organization, any business, any industry, and ensuring that folks have an opportunity to be represented in an organization is essential to the fiber of an organization. I jokingly say that I think diversity and inclusion is like heaven. You know, it doesn't exclude anybody. Everybody has the opportunity or should have the opportunity to be there. So in my role in healthcare, it's ensuring that those of us who serve the community reflect the communities that we serve, and that is indicative of our hiring processes, the leadership, and all of those who represent the organization.
And I understand that visually speaking, it's it represents a comfort level. When you walk into a business that has diversity, inclusion, you're like, yeah, I feel comfortable here. There's someone that looks like me, and there's someone that looks like my neighbor down there, and wonderful. I guess, is that alone a beneficial thing relative to, in my, a libertarian mindset? I want to see all the resumes stacked up, and I want them devoid of anything representing color, race, creed, ethnicity, because I don't want to be biased by that. Everyone who's in employment hiring is going to be naturally biased. It's like the Trump Mueller investigation. Yes, they have political bias, and no one thought they didn't.
Right.
It's a question of whether it interferes with the process of selecting the best person for the job. If I want my heart operated on, if I'm going to get my heart operated on, I don't care what color skin that person is. I want them to be the best. I want them to have the A. I want them to be the one that got, like Dean's List or whatever, or one that has the most surgeries under his or her belt. Substantively, you can point to it. How do you balance that?
Well, the balance comes first from, as you said, identifying the best and the brightest and the top. And it's not so much about color as it is about quality. You want the best to be represented in anything that you do.
Sure.
So as you go out and seek the best, the added benefit is being able to connect them culturally, racially, ethnically. Diversity of thought is so key as well, because you don't want everybody thinking alike representing an organization. You need to be able to challenge the thought processes or challenge the conventional way that things have always been done.
Sure.
So being able to have differences, which is what we honor and respect. We respect the differences. We respect those things that are not like what we're accustomed to, so that then we can have the best. And it's not just about seeking the best individual, it's about seeking the best outcomes as well.
And the best outcomes being for the patient in your particular case.
Yes, for the patient and for our team members, for our employers, our employees, our physicians, and everyone that we encounter, because healthcare touches everybody.
Right. Well, in the terms of healthcare, best outcome for me is I go in sick, I come out well. That's how I'm evaluating my healthcare experience. I'm going to be real broad-minded. I don't care who's working on me, as long as they're top-tier qualified and they know how to get the job done. Again, that's kind of what I'm looking for.
Yes.
Well, let's talk about how diversity issues impact today's modern workplace. Okay, I've talked about the patient experience, and I've talked about sort of the expectation that, a prudent, unbiased employer is going to be looking for the best. But it's beyond that, I would imagine. There's more political layers here and currents that flow in the workplace than I'm giving credit for. So that's why you're here. What are they?
Well, some of the challenges and issues stem around workforce, of course, trying to find the best and brightest to come in and work for an organization and have that workforce be reflective of the community that we serve, or as best as reflective of the communities that we serve. one of the things that TriHealth and we have identified is that we've made great strides in the past, and on a broader scope, we are reflective of the community to a pretty fair degree. But we still have work to do. So in our leadership rankings, from our executive leadership, board leadership, physician population, we have work to do in terms of improving in those areas of being more reflective of the communities we serve.
Okay, and I'm thinking, I wrote down STEM because I've talked to so many manufacturers in the area. They're standing around with real high-paying jobs, really good jobs, and all they need is like some kid out there to do a 6-month program at Cincinnati State or a 1-year program. It doesn't cost $100,000 for a 4-year college education. Heck, it's in the $1,000 or even sometimes less than. And they come out with the qualifications to fill a job and make maybe $75,000 a year right out of the box. They can't find the people to fill it. If they can't find anyone to fill these jobs, I mean, it seems to me they're going to care a whole lot less about diversity. They just want someone who meets the fulfillments of the job application.
Well, that's an excuse that we can't find those individuals. And you know, I work a lot with different partners around the city on initiatives such as the STEM initiative.
Good.
Working with Hughes High School, and
Excellent.
One of the programs that they're doing there is to bridge that gap.
I'm so happy to hear
Fill
that.
the pipeline and start giving exposure to underserved populations and students that fit that diversity we're looking for, to be able to get exposure to these programs, enroll in these programs, and be part of that pool that fills those jobs that you're talking about.
Yeah, I just say be part of the solution, man. If there's an empty job that needs to be filled, that sounds to me like a call to arms. Get that $500 loan or $1,000 loan. It'll be worth it, man, because that's something you can pay off in 1 year's salary, right?
Well, that's where we look at strategic partnerships. So, you
Right.
know, and what our role is as TriHealth or as our partners at GE or Centos or other organizations that are out there, and say, what do we own in that process of either providing that scholarship or providing that opportunity or improving that access for that individual to get into that program? Because it's all about removing the barrier for
sure.
them to get in there. And a lot of times it's something that we in our roles have the responsibility or opportunity to do. We just don't take the initiative to do it. So, you know, the conversations need to take place.
Jamal, sometimes it's just for want of getting the information in. Like, are you kidding me? There's that kind of program out there?
Right.
How in the hell I didn't know about this?
Right.
Fine, you're on your way. Good. Don't go away, Jamal. We're going to be talking Jamal Boyd, Director of Diversity, Inclusion, and Language Services with TriHealth. Going to ask him about some of the health disparities that exist in the community and programs that are implemented to help serve the underserved. After this quick word for advanced patient imaging. Speaking of healthcare, how about free market? 851, 55 KRC, the talk station. Brian Thomas here with Jamal Boyd. He is the Director of Diversity, Inclusion, and Language Services at TriHealth. Talking about the importance of diversity in the workplace, getting folks in the right positions, helping you feel comfortable about those who are serving you, and helping get the best people in those capacities, which, of course, particularly in the area of healthcare, that's what we're looking for. But let's talk about some of the areas, and I know you deal with this all the time, Jamal, which is health disparities in the community. And how does this impact the services that TriHealth provides?
Well, it impacts it directly because we have to be laser focused on processes that eliminate health disparities. So when you look at chronic disease and diabetes and heart failure and all of those things that impact the community directly, if we're not caring for those conditions and removing those conditions, those are the folks that are populating your emergency room.
Right.
And they're not getting appropriate access to immediate care, but also follow-up care. So we have to put programs and services in place to address that. And 9 times out of 10, you would see that those chronic diseases are impacting communities of color or communities that have less access to the resources that they need.
Oh, sure. I see this, and you hear about it in rural communities, like West Virginia, man. It's just like poor
Yes.
and out in the middle of nowhere. And trust me, nobody's coming over to their house and explaining to them how you're supposed to treat the feet problem you have, which are a consequence of diabetes, right?
Right.
And, that's a ripple effect.
Absolutely.
So preventative is really important, and that's an education component.
Yes. And
Then there is maintenance, and then if you have something crop up, if you have diabetes or come up with one of these, then it's proper disease management and maintenance and getting them on perhaps like a disease management program to help them stay well.
And that's where our programmatic services are essential. Care coordination and ensuring that people do have the education that they need to treat it in a preventive way, but also in a management way, so that then you can begin to eliminate those. And I think a more educated community is a healthier community.
Well, and I also think about it in terms of, and I know obviously as a healthcare provider, TriHealth has got to be impacted by the heroin epidemic and the opioid explosion, and that hits every community everywhere. And I'm just convinced, Jamal, that education will go a long way on that one. If you get kids to understand how devastating these things are and how random it is that carfentanil or fentanyl might just show up in something you're buying from some joker that you met on the street, they might be less inclined to do it.
Yes. And again, that education is essential, because if you know better, you'll do better. And what we try to do is, one, look at how the education can have an impact on care, and not be so quick to, quote unquote, discharge a patient because they're not compliant. But how do we work with you to develop a relationship between the provider and the patient that gives you the education that you need, that causes you to comply with what the doctors and the systems are asking you to do?
Well, let me just use my experience with my physician, and I love the man. He's a great guy. I've been seeing him for 10, 15 years. He struggles with the amount of time he has to spend on the computer inputting records, as opposed to the amount of time he spends with his patients actually talking with them about what you're talking. I mean, if he had an extra 10 or 15 minutes when he's not sitting there on the dang computer dotting I's and crossing T's because of all these compliance forms, he might be able to stress how important it is, watching your blood sugar level or exercising, or, if you want to get rid of this problem, we need to go down this road. You need to really focus at it. More about interaction, more about education even there, than about the forms and the paperwork. And I don't know how you and I could overcome that problem in this short discussion, Jamal.
Well, it's interesting because, I'm thinking of a personal experience with my doctor, and I think as we look at technology, and that's another part of inclusion, getting with what's going on in the time to meet those needs, both for taking care of the documentation, but as well as having that personal touch with your patient. So My doctor uses Google Eye as an example, and it's these glasses that the doctor can really document the visit without even having to touch a computer for the most part, but also being able to engage with the patient, make eye contact, and still have that personal touch.
How about that?
It's a change, and it's an adoption of technology for many of the providers that are out there, but it's a way to kind of mutually meet the need, or a mutual compromise, so to speak. So
while technology has created onerous burdens, technology can also relieve those onerous burdens. So we're moving hopefully toward a more patient-focused practice of medicine, or return to it anyhow.
Absolutely, because, we have to document. We have to capture what's going on, so that then, again, we mitigate risk, but we also make sure that we're providing the patient with the most top-quality care at all times. But you still want to have that personal touch to engage the patient. It's about the relationship, because now I'm more compliant because I feel like you care. And I feel like you know what you're talking about as well.
And ultimately, what we're looking for is savings for everyone.
Correct.
No less hassle for TriHealth, pass along savings to us, the consumer. If we stay well, we're not having to deal with TriHealth. Everybody wins then.
It's a healthier community.
Great meeting. And Jamal Boyd, he is, again, the Director of Diversity, Inclusion, and Language Services for TriHealth. And great having you in studio and talking about these issues, Jamal. And I wish you the best of luck in reaching those communities, especially on education.